Now I am going to draw some important lines, and of which I will start with the anterior border of the left lung. First of all, I will palpate the clavicle. This is left clavicle, and I will divide the clavicle into the medial 1/3 and lateral 2/3. So this is the medial 1/3, and I will take a midpoint of this medial 1/3. If this is the medial 1/3, I will take a midpoint of the medial 1/3 here. I will take another point. This point is about 2.5 cm above this point. I will consider this is the first point. To give this point, I have taken the midpoint of the medial third of the clavicle. Now I am removing this one. So this is the first point. The second point I will mark on the left sternoclavicular joint. This is the clavicle, this is the sternum. So here is the sternoclavicular joint here. Third point, I will put it on the sternal angle slightly to the left of the midline. This is sternal angle. So I will put a point here at the level of sternal angle, but slightly to the left. And the fourth point I will put over the body of the sternum, slightly to the left of the midline once again, but at the level of fourth costal cartilage. You know this is the sternal angle level. So this is second rib, second costal cartilage, then third, then fourth. So here I will put a point on the sternum, body of the sternum, slightly to the left of the midline over the fourth costal cartilage. And the fifth point will be on the left fourth intercostal space and 3.5 cm away from the sternal margin. This is sternum, so this is the sternal margin, and this is the fourth costal cartilage, this level. So this will be fourth intercostal space. So from the sternal margin, I will go 3.5 cm lateral to the lateral margin of the sternum, and I will put a point here, and the distance from this margin about 3.5 cm. Then I will put another point which will be on the sixth costal cartilage, and it will be 4 cm away from the midline. This is 3.5 cm from the sternal margin. I will take a point 4 cm from the midline here on the sixth costal cartilage. This is fourth costal cartilage, then it is fifth, it is sixth. So I will give a point here, and the distance is 4 cm. Now we have got 1, 2, 3, 4, 5, 6 points. Now I will join all these points here in this way. Yes, this is the anterior border of the left lung. Here we got the deviation from the fourth costal cartilage, then sixth costal cartilage here. This is the deviation, and the anterior border is thin and sharp because the anterior border is sandwiched between the heart with pericardium inside and the anterior thoracic wall outside, and posterior border of the lung, it occupies on the paravertebral gutter, so it is rounded. This notch here, it is called the cardiac notch. Due to the formation of the cardiac notch, the heart with pericardium in this region, it is uncovered by the lung and is called the area of superficial cardiac dullness. The lung is deviated toward left side because of the heart. So here the heart is uncovered by the left lung and pleura. So if I percuss on this side, we will get the dullness for the heart inside. And the lingula, it is a small projection on the anterior border of the left lung. And what is the difference between the anterior border of the left lung and right lung? On the right side, the anterior border of the right lung, it corresponds to the costo-mediastinal line of pleural lip flexion, and it is more or less vertical. But on the left side, the anterior border of the left lung follows the costo-mediastinal reflection up to the fourth costal cartilage, and then it deviates laterally, forming a notch, this cardiac notch. But this notch is not there on the right side. If I draw this, the same thing will happen. Same thing will happen here, and the line will be in this way. Yes, this is the anterior border of the right lung. So this is the difference of the anterior border of right lung and left lung. Now I will draw the right border of the heart. You know, heart is having mainly three borders: right border, then inferior border, and left border. So of which I will draw the right border of the heart. And how to draw? I will take a point on the third costal cartilage, and it will be on the right third costal cartilage. This is the sternal angle. So this is second costal cartilage. So this is third costal cartilage. This one. So I will take a point on the third costal cartilage on its upper border. It is about 2.5 centimeter from the midline. This is the midline. So it is about 2.5 centimeter. I will take a point over the upper border of the third costal cartilage here. First point. Second point I will take on the right fourth intercostal space 4 centimeter away from the midline. So this is the midline. This is the third costal cartilage. So it is third space. Then fourth costal cartilage, it is fourth space. So I will take a point about 4 centimeter away from the midline in the right fourth intercostal space here. And the third point will be on the right sixth costal cartilage close to the lateral margin of the sternum. This is the sternum, this is lateral margin. So this is fourth space, though this is fifth costal cartilage and the sixth costal cartilage. So I will take a point on the sixth costal cartilage here, and this point will be on the lateral margin of the sternum. Now I will join the 3 points which will represent the right border of the heart. Then what are the questions may be asked from the right border? And I told you the heart is having mainly 3 borders, and the right border, it is formed only by the right atrium, and it is convex and round, and it extends from the right side of the superior vena cava opening to the opening of the inferior vena cava, and this border separates the sternocostal surface or anterior surface from the base of the heart behind. And which important structure or important anatomical features you will get on the right border? The answer is, it is a vertical groove called sulcus terminalis runs along this right border, and this sulcus terminalis, it corresponds with the ridge inside that is called crista terminalis. And the importance of crista terminalis is it separates the interior of the atrium into 2 parts. One is anterior part or the rough part called atrium proper, and another one is posterior part called sinus venerum, which is the smooth part. And another important structure lies at the upper end of this sulcus terminalis, that is the sinoatrial node. Another important border of the heart is the left border. The left border, it separates the left lateral surface from the sternocostal surface of the heart. Then how I will draw this? First of all, I will locate the sternal angle once again, and here is the second costal cartilage. I will take a point on the left second costal cartilage on its lower border. So this is the second sternal angle, this is second costal cartilage. I will take a point at the lower border of the second costal cartilage, which is about 2.5 centimeter away from the midline. And second point I will take at the apex of the heart. That means in the second space, third space, fourth space and fifth space. So from the midline, I will take a point 9 centimeter away from the midline towards the left side, which represents the position of the apex of the heart. Now I will draw this a line which is slightly convex towards the left side, this way. So this is the left border of the heart. Then what are the questions when we ask from this left border? The left border, it is mainly formed by the left ventricle and partly by the left atrium or left auricle, and this border, it extends from the left auricle to the apex of the heart, and the artery which lies on the left border is the marginal branch of left coronary artery. And there are 2 angles are there called cardiophrenic angle. That if you see the diaphragm, then here you will get an angle, and here also you will get an angle called cardiophrenic angle. This cardiophrenic angle, the measurement is not equal on both sides. The right sided angle is acute, but the angle on the left side, it is obtuse. And the inferior border of the heart, it is sharp border extending from the opening of the inferior vena cava to the apex of the heart. If I join this point and this point, I will get the inferior border of the heart. This one. So the red color marking, it indicates the inferior border of the heart. And if you are asked what is incisura apicis cordis, it is a notch on the inferior border of the heart close to the apex. This is apex. So here you will get a notch. This notch is called incisura apicis cordis. And this border is mainly found by the right ventricle and partly by the left ventricle near the apex. And the important structures running along this inferior border is the right marginal artery. And you know the left border, here you will get the left marginal artery, and here you will get the right marginal artery, branch of right coronary artery. And this border separates the sternocostal surface or anterior surface of the heart from the diaphragmatic surface or inferior surface. Next line is the arch of the aorta, one of the most important surface marking of the thorax. Aorta, it is the artery, so I will draw with red ink. Before drawing, again we have to locate the sternal angle, which is very important landmark, sternal angle. And at this level, on the right side is the second costal cartilage, on the left side is the second costal cartilage. This arch of the aorta, it is a continuation of the ascending aorta behind the right second chondrosternal joint. So I will take a point on the right chondrosternal joint, that means sternal angle. Here is the joint. Here I will take a point on the right side. On the left side also I will take a point. I will join these 2 points and show that the convexity upwards here like this, and the center of this convexity, it reaches up to the center of the manubrium sternum. Here is the upper limit or maximum convexity, and this is the center of the manubrium sternum. Manubrium sternum means this is the sternum angle, this is the suprasternal notch, so this is the manubrium sternum. This part of the sternum is called. And the convexity, you can see here, the convexity, it is upwards, and the branches from the arch of the aorta are 3 main branches. One is the brachiocephalic trunk, then left common carotid, then left subclavian, and some abnormal branches also there. They are not common. Still you can remember these branches, namely the arteria thyroida ema, then left vertebral artery, left bronchial artery, inferior thyroid artery, and internal thoracic artery. Another thing you will get in the X-ray, straight X-ray of the chest, that is called the aortic knuckle. The aortic knuckle is a convex bulging on the left side of the sternal angle formed by the distal part of the arch of the aorta. Here, due to this, you will get a prominence or knuckle. In situation of the arch of the aorta is in the superior mediastinum, because sternal angle is there, so above it is superior mediastinum. So you will get this arch in the superior mediastinum only. Next surface marking will be the superior vena cava. It is a vein, so I will draw with blue ink. So before drawing, again I have to locate the sternal angle. This is sternal angle, and this is second costal cartilage, and above it is the first costal cartilage, this one. So I will take a point at the lower border of the right first costal cartilage here, and another point will be on the upper border of the right third costal cartilage. This is second costal cartilage because this sternal angle, and this is third rib or third costal cartilage. So I will take a point at the upper border of the third costal cartilage. So this is lower border of the first costal cartilage, this is upper border of the third costal cartilage. Now I join these 2 points with 2 parallel lines here. These 2 parallel lines, they are 2 centimeters apart from each other. So this is the superior vena cava. How this vena cava is formed? It is formed by 2 veins. One is right brachiocephalic vein and one is left brachiocephalic vein. 2 veins join to form the superior vena cava, and it opens into the interior of the right atrium of the heart. and its length is about 7 centimeter and width about 2 centimeter. And the two parts of superior vena cava is, one is extrapericardial part, one is intrapericardial part. The extrapericardial part, it lies in the superior mediastinum, and intrapericardial part, it lies in the middle mediastinum. And the main tributaries of the superior vena cava are the azygous vein, then pericardial vein and mediastinal vein. But the azygous vein, it joins with the superior vena cava in the arched manner, in this way. So here more or less the point of termination of the azygous vein. So sternal angle, it is a useful guide between the extrapericardial and intrapericardial part of superior vena cava. No valve of the superior vena cava. So that's all for the superior vena cava.